The most important treatment for leukemia is chemotherapy. And if we look at acute lymphoblastic leukemia, it is one of the wonder stories of our time. 40 to 50 years ago, if a child was diagnosed with leukemia, the child was put onto palliative treatment, some morphine for pain, and the child was sent home. But now, if we look at high-income countries, the survival from acute lymphoblastic leukemia is between 85 to 90%. So it really is a success story of modern medicine. The thing about leukemia is that if we had to have modern treatment, conventional treatment with all the old drugs, we can get a good survival. But there are some children who have a really poor biology with a very high-risk type of leukemia. For them, we will consider some of the new and novel targeted therapies. And the entity of bone marrow transplantation is also one of the reasons why children living in high-income countries have raised the survival. The survival for these children is raised to over 85 to 90%. It is because they are very fortunate that they are able to have access to allogeneic stem cell transplantation. The problem for us in South Africa is we have a lack of donors. Many of our children do not have matched sibling donors. They may be half siblings, so you cannot get a full matched sibling donor, which would be the ideal, which would be the best. Then we know if we cannot get that, then we looked for an unrelated matched donor. And this is where the problem comes in. In South Africa, we have very few donors on the registry. So it is a really big problem to offer our patients this curative treatment of stem cell treatment or bone marrow transplantation.